As a child, I was diagnosed with stage 4 neuroblastoma. I'm a cancer patient myself. I was treated with chemotherapy and surgery, and I feel extremely grateful to be here and have an opportunity to give back. I think early on that sort of carved a path for me to have an interest in medicine and be inspired by my surgeons and my medical doctors who helped me, and just seeing them as role models. And over time, I sort of got involved with shadowing and more experiences that pointed me towards wanting to work with children and adults with cancer. And through medical school, sort of found an opportunity through a mentor, Dr. Benevenia, who I've now joined as a partner of his, to work with people with bone and soft tissue cancer. I think being a cancer patient myself, having an understanding of the stresses and the challenges, not just for the patient, but really watching my parents go through the things they did and experience the emotional stress of having a sick child or a sick family member. And I think that hopefully gives me an extra sense of compassion with those patients and an understanding. In my field, one of the most rewarding things is our ability as orthopedic oncologists to restore a patient's function and improve their pain in a really short span of time. We're really fortunate to have that opportunity that in the operating room, you can take someone with a fractured bone or a tumor that's been causing them pain, either remove those things or fix them or whatever the necessary treatment is. And you take a patient who may have been bedbound or non-ambulatory in some way and they're walking the next day. That's incredibly powerful. In addition to the oncologic component of it that we really enjoy and collaborating with our colleagues, it's really the function and the pain improvement for our patients that we're fortunate to be a part of.